Let's get right into it. Number 10, feeling thirsty all the time. Everyone gets thirsty after a workout or a salty meal, but thirst that doesn't go away no matter how much water you drink is a different story. Persistent, unusual thirst combined with needing to urinate frequently, especially at night, is one of the most common early signs of high blood sugar since the body tries to flush out excess glucose through urine, which in turn dehydrates you and triggers constant thirst. It's often dismissed for months because it feels so minor, just drink more water and move on. Doctors frequently point to this exact combination, constant thirst plus frequent urination, as one of the clearest early signals that blood sugar levels deserve a proper check, well before more serious symptoms show up. Number 9. Sudden changes in vision. A sudden curtain-like shadow across part of your vision, a burst of new floaters, or a flash of light in your peripheral vision isn't just eye strain from screens. These specific symptoms can indicate a retinal tear or detachment, where the light-sensitive tissue at the back of the eye starts pulling away from its normal position, and it's considered a genuine medical emergency because delaying treatment can mean permanent vision loss. Sudden vision changes affecting only one eye can also be an early warning sign of a stroke or a blocked blood vessel in the eye. Because vision problems often come on gradually with age, a sudden and specific change like this is exactly the kind of symptom that gets brushed off as tiredness until it's too late to reverse. Number 8, feeling exhausted no matter how much you sleep. Everyone has tired days, but fatigue that doesn't improve with rest, that lingers for weeks and interferes with normal daily functioning, is the body signaling something deeper than a bad night's sleep. This kind of persistent exhaustion is commonly linked to iron deficiency anemia, an underactive thyroid, or undiagnosed sleep apnea, where breathing repeatedly stops during sleep without the person ever fully waking up or remembering it. Sleep apnea in particular is often missed for years because the person assumes they're simply sleeping enough hours, without realizing the quality of that sleep is being constantly interrupted. Chronic fatigue is also one of the more commonly reported early symptoms across a wide range of conditions, which is exactly why doctors take it seriously as a starting point rather than dismissing it as simply being busy or stressed. Number 7. Numbness or weakness on one side of the body. Sudden numbness, tingling, or weakness that affects only one side of the face, arm, or leg is one of the clearest warning signs the body can give, and it's specifically associated with stroke. The classic advice, remembered through the acronym FAST, stands for face drooping, arm weakness, speech difficulty, and a time to call emergency services, because with stroke, every minute of delayed treatment increases the risk of permanent brain damage. What makes this symptom particularly dangerous is that it's sometimes painless and can resolve on its own within minutes, a pattern known as a transient ischemic attack, or mini-stroke, which people frequently dismiss once the symptoms pass, not realizing it's often a serious warning that a larger stroke could follow. Number 6, losing weight without trying. Gaining or losing a few pounds naturally happens for all kinds of reasons, but losing a significant amount of weight, generally more than 5% of body weight, without any change in diet or exercise, is something doctors take seriously. Unexplained weight loss can be an early sign of an overactive thyroid, diabetes, or in some cases an underlying inflammatory condition, and it's frequently listed among the possible early indicators worth investigating further with a doctor. It's easy to view unexpected weight loss positively at first, especially in a culture that often praises thinness, which is part of why it commonly goes unmentioned to a doctor for months. Number 5. Yellowing of the skin or eyes. A yellow tint to the skin, or the whites of the eyes, known medically as jaundice, happens when a substance called bilirubin builds up in the blood faster than the liver can process it. This can point to liver inflammation, blocked bile ducts, or in some cases certain blood disorders. And it's the kind of symptom that's often noticed by someone else, a friend or family member, before the person themselves realizes anything looks different. Because early jaundice can be subtle, especially in people with darker skin tones where it can be easier to miss on the skin and more noticeable in the eyes, doctors specifically recommend checking the eyes in good natural light if this is ever suspected. Number 4, swelling in the legs, ankles, or feet. Some swelling after a long flight or a day on your feet is completely normal, but persistent swelling that doesn't go down with rest and elevation can signal that the heart, kidneys, or liver aren't functioning as well as they should. When the heart struggles to pump efficiently, fluid can back up in the lower body, causing visible puffiness that leaves an indentation when pressed, a sign doctors specifically look for during a physical exam. Swelling that shows up in only one leg, especially with pain, warmth, or redness, is treated even more urgently, since it can indicate a blood clot that carries serious risk if it travels toward the lungs. Number 3, chest pain or pressure. Chest discomfort gets dismissed constantly, often blamed on stress, indigestion, or a pulled muscle, and sometimes that's exactly what it is. But pressure, tightness, or pain in the chest, especially if it spreads to the arm, jaw, or back, or comes with shortness of breath, sweating, or nausea, is treated as a potential heart attack until proven otherwise by medical professionals. Notably, heart attack symptoms in women are frequently less dramatic than the classic clutching chest image most people picture, often presenting instead as unusual fatigue, nausea, or upper back pain, which is a major reason heart attacks in women get misdiagnosed or dismissed more often than in men. Number 2, changes in your fingernails. Fingernails might seem like the last place the body would send a warning signal, but doctors actually look at them for clues about internal health. Nails that curve downward and become unusually rounded, a change called clubbing, can be associated with long-term lung or heart conditions that reduce oxygen levels in the blood over time. Spoon-shaped nails that dip inward instead of curving outward are commonly linked to iron deficiency anemia. Because nail changes happen slowly, they're easy to miss in yourself, which is part of why doctors often notice them first during routine exams, sometimes flagging an issue the patient hadn't even thought to mention. Number 1, pain that doesn't go away. Everyone experiences aches and pains that come and go, but pain that persists for weeks, doesn't respond to normal rest or over-the-counter relief, or steadily worsens instead of improving, is one of the most consistently cited early warning signs across many serious conditions, including certain cancers. Persistent, unexplained pain, especially when it shows up somewhere new without an obvious injury, is exactly the kind of symptom doctors say gets normalized and pushed aside the longest, because people assume it will eventually pass on its own. Medical guidance consistently points to the same basic principle that pain lasting more than a couple of weeks without a clear explanation is worth having checked out, not because it's always serious, but because catching a real problem early almost always leads to better outcomes. This video is for general information only and isn't a substitute for professional medical advice. If anything here sounds familiar, it's worth bringing up with a real doctor. That's all for today. I'll be making similar videos in the future. Subscribe to see them,